this looks like a very mild disease, like a common cold, in the majority of people. There are certain people who get infected and have very serious illness. Among them are health workers. It's a very serious infection in them as they get a higher dose than normal people, and at the same time they have no immunity. So in the general population, it's likely that the dose of virus that you receive when you are infected is much less than the dose that a health worker would receive, health workers having more serious infections. So your infection would be less serious, hopefully. So that leaves the elderly and those with comorbidities to really be the ones that we have to make sure are taken care of in hospitals. Well, the most concerned are people who are, first of all, in developing countries and who don't have access to good medical care and may not have access at all to a hospital should an epidemic occur in their country. Those people would be at great risk, especially the elderly. Elderly in all populations are at risk, but especially those who can't get to oxygen. In industrialized countries, it's the very elderly who have comorbidities, who have diabetes, who have other diseases, who are at risk. The general population doesn't appear to be at great risk. First of all, pulmonary disease existing as a comorbidity is also important. In general, the elderly are at greater risk, especially those over 70, because their immune systems are not as effective as they might have once been, and they're more susceptible to infections. In addition, in some instances in China, there's been a co-infection with influenza, and at the same time there have been some bacterial superinfections on the pneumonias that are occurring. The Center for Disease Control in Atlanta keeps track and has updates on a regular basis on its website. Also, the World Health Organization in Geneva, which is coordinating many of the activities going on internationally, also has a website with daily updates. It's our responsibility to get that information as individuals so we understand and can make sure that we can contribute in our own way to prevention of major spread. It's the same problem with all new infections. This is an infection that's come into humans who have never been exposed to this virus before. They don't have any antibody protection, and it's not clear whether their immune system can handle this virus or not. This is a virus that usually finds itself in bats or in other animals, and all of a sudden it's in humans. And humans just don't have experience with this virus. But gradually we are beginning to learn a lot, as we did with SARS. And, you know, there are certainly a larger number of deaths than there were with SARS, but when you divide that by a denominator of persons who are infected, there are many, many more persons infected than there were with SARS. The case fatality ratio, that is the ratio of deaths to the numbers of cases in SARS, was about 10%. With the current coronavirus, COVID-19, is 2% or probably less. So it's a much less virulent virus, but it's still a virus that causes mortality, and that's what we don't want entering human populations.